Hey everyone, as promised, we're giving you a behind the scenes look at what it's like to meet with a Neura Health provider virtually. One of the most frequently asked questions the membership team gets is what actually happens during the initial visit? Even better, we get asked how can a neurology appointment even work virtually? Well, instead of just telling you, we thought why not ask a neurologist directly? I'm excited to be joined today by Trevor Wright, one of our experienced providers here at Neura Health. Trevor's going to walk us through what a typical first visit looks like, how virtual neurological exams are done, and how care plans are developed and supported for our patients over time. So whether you're exploring neurology care for the first time or you're already part of the NeuraHealth community, this session is designed to give you a behind-the-scenes look at what it's like to meet with a neurologist virtually. So let's jump in. As I mentioned, I'm joined today by Trevor Wright, one of our licensed neurology providers at Neura Health. Trevor brings a compassionate and thoughtful approach to care, and he's here to walk us through what you can expect during your visit and beyond. Trevor, welcome. We're so happy to have you here. Tell us a little bit about yourself.
Hi, Kelly. Thanks for having me. I'm really excited to be here. So, a little bit more about me. I've been working in neurology as a nurse practitioner for the last 10 years or so. And over that time, I've had a chance to help patients with a wide variety of conditions, from things like headache disorders, including migraine, to other neurologic conditions like epilepsy and memory loss. What I love most about this work is helping people find answers and helping them to achieve a better quality of life by feeling better and doing the things that they love. And just so we're clear, a neurologist is a medical professional who specializes in conditions that affect the brain, spine, and nervous system. That can include things like dizziness, pins and needles, cognitive changes, and of course, chronic pain disorders like migraine. We look at patterns, mental status such as cognition, symptoms, test results, and we work collaboratively with the patient to figure out what's going on and to set up an effective treatment plan.
Awesome. Thank you for that, Trevor. It's so helpful to understand what a neurologist actually does, especially for people who may have never seen one before. So let's talk about that first visit. For someone who's just signed up at Neura Health and is preparing for their first 45-minute appointment, what can they expect?
That's a great question. We really use that time to get to know the patient as a whole person. If able, we also like to hear from friends, family, and caregivers because everyone brings a valuable experience to the table. We talk through symptoms, medical history, any prior diagnoses or treatment, and just as importantly, how these symptoms are impacting someone's quality of life. We also conduct a virtual neurology assessment, which allows us to physically evaluate what's going on. It's not rushed. We want patients to feel that they're truly being heard and that their concerns are valid.
That's such an important distinction, being heard. So, can you give a high level explanation of what a neurological exam looks like in a virtual setting?
Absolutely. A virtual neuro exam focuses on observation and interaction. We might ask patients to complete standardized cognitive assessments, perform simple movements such as standing or walking in a line, to describe their sensations to us or to respond to prompts that help us to evaluate things like their coordination, their speech, memory, and strength. These evaluations are approved by the American Academy of Neurology and are very thorough. We are trained to pick up on small, subtle signs that help us to determine what's going on neurologically, and this exam is an important component of that.
It's pretty amazing how much can be assessed virtually. Now, once you've done the exam and gathered the patient's health history, how do you approach creating the care plan?
Yeah, that's really important. We create a care plan with the patient, not just for them. That might include recommendations for lifestyle changes, medications, follow up testing, or referrals. We also work with our support staff, our care concierge, and our coaching team at Neura to provide ongoing support. The plan is always personalized and it evolves over time as we learn more about the patient and their needs.
That collaborative approach really defines Neura's model. It's not just a one and done visit, it's the beginning of an ongoing relationship for patients who may be unsure about whether to sign up as a Neura patient and book the initial visit. Is there anything else you want them to know?
I think the most important thing to know is that you don't have to wait until things are bad enough to seek support. Neurologic symptoms can be confusing or easy to dismiss, especially when they come and go. But starting care early can make a big difference, not just in how you feel, but in how well we can treat and manage what's going on. Whether you're dealing with something new, something ongoing, or you're just not sure where to start, we're here to help to make sense of it all. We don't need you to have it all figured out before reaching out. That's what we're here for, every step of the way.
Awesome. Thank you so much, Trevor. That was incredibly helpful and reassuring. So, to everyone that's watching, if you're ready to take the next step, you can book your first visit at www.neurahealth.co